Strategy number 15. Consider unit policies and timeframes. NCLEX questions often ask questions that require you to prioritize actions that are governed by strict facility policy or involve a strict ordered timeline. These must be attended to first. These may include administering STAT medications, performing certain reassessments, or obtaining new orders and assessing clients and restraints. Activities that are regularly scheduled usually have room for flexibility. For example, a dressing change is not time sensitive, and most scheduled medications may be given within a half hour of the scheduled time, from a half hour before the scheduled time to a half hour after. The exception would be insulin or another medication that needs to be given at a very specific time or just prior to a meal or procedure. For some questions, the correct answer may be one that shows that the nurse can manage time effectively. In questions that involve preoperative clients or those with specific discharge times, the correct answer is often the one in which the nurse sees the client before other stable clients to make sure the procedure or discharge is expedited so others are not made late.